Hello and welcome. My name is David Whitesides, and I would like to thank you for taking this time to listen to my presentation. In this presentation, you will learn how to combat arthritis pain through exercise. Okay, to start, let's see if we can answer this question: what is arthritis? The ACSM states that arthritis and rheumatic diseases are the leading cause of pain and disability worldwide. So this is a pretty major thing we're dealing with in movement, in bodily movement. Also, the U.S. National Library of Medicine defines arthritis as an inflammation of one or more human bodily joints. A joint is an area where two bones meet. Also, the U.S. National Library of Medicine claims that arthritis involves the breakdown of cartilage in a joint. See, normal cartilage protects the joint and allows the bones to move smoothly and pain-free. Cartilage also absorbs shock when pressure is placed on the joint, such as when you walk. Without normal amounts of cartilage, the bones of the joints rub together and cause swelling, inflammation, pain, and stiffness. This is not good. As you can see in the picture to the right, in the left hand, you can't really see the cartilage, but it's there, and the blue coloring means that it's easy flowing and good to go. The red in the right hand over there shows the inflammation and very stiffness and sometimes deformation of the joint. Arthritis is very common, but it's not well understood. And piggybacking off of that, arthritis is not usually just one single disease. It is an informal way of referring to joint pain and joint disease. So it's just still not understood, and your symptoms and treatments is going to be individually based. There's no single way of treating it. Okay, the types of arthritis. We're not going to go into all 100, but there is 100 different types of arthritis and rheumatic diseases. The two main or common ones is osteoarthritis and rheumatoid arthritis. Some of the rheumatic diseases that is associated with this disease is fibromyalgia, systemic lupus, erythematosus, gout, and bursitis. Osteoarthritis, by definition, is a local degenerative joint disease that can affect one or multiple joints, commonly in the hands, hips, spine, or knees. Rheumatoid arthritis is a chronic systematic inflammatory disease in which there is a pathological activity of the immune system against joint tissues. So this would be the breaking down of the cartilage, what we were talking about in the slide before. Systemic lupus erythematosus is a chronic inflammatory variable autoimmune disease of connective tissue that occurs mostly in women and typically characterized by fever, skin rash, fatigue, and joint pain mostly. To the right is a picture of a young lady with some of the disease on her face. So the pain would be localized to her face at this one, but it could be anywhere to elbows, arms, knees, legs, whatever. Gout, another rheumatic disease, by definition, is a disease which defective metabolism of uric acid causes arthritis, especially in smaller joints of the feet. So you get a buildup of uric acid around the great toe joint of the foot. And I've had friends that have had it, and they are not able to go to work for a couple of days until they get some medication in them that takes 24 to 48 hours to get through their system to relieve the pain. And alcohol could be a cause of that as well, or your diet could be the cause of the gout. And bursitis is just simply the inflammation of the bursa, and the bursa is little fluid-filled sacs that supply cushioning around the joints. Who is affected by arthritis? People of all ages, sex, races can and do have arthritis, and it is the leading cause of disability in America. Among the adults in the United States, 18 years or older, about 23%, or almost 50 million people, have been diagnosed with arthritis. And the prevalence of arthritis, as the majority of the population gets older, is definitely going to increase for years to come. As for treating arthritis or pain associated with arthritis, for small flare-ups or acute flare-ups, analgesics like Icy Hot or kind of Emu Rub, NSAIDs, non-steroid, anti-inflammatory drugs can be taken orally, or even if it doesn't hurt, stretching can help alleviate some of this pain. Stretching can also lead us into long-term helping with long-term symptoms. Self-management is, do what the doctor said. Go to the doctor, ask for advice, and do what he says to do. Exercise up until you feel pain, and then stop. It's great if you don't feel pain outside of normal, muscle strain of normal overload of the weights. Treat yourself to some physical therapy or occupational therapy. Since I'm a massage therapy, I've treated a number of patients with this condition. Last but not least, if you have to, surgery may be an option for you. But I don't agree with surgery, so I would hold off until that's the very last thing to do. Here we go. The main reason for doing this presentation is exercise treating this condition. The ACSM recommends the ample time to be allowed for individuals to warm up at a light intensity level prior to beginning graded exercise. So you're going to need to test your limits, range of motion, flexibility, muscular strength, endurance, and cardiorespiratory fitness levels and flexibility levels before you can train them. Anytime you should not feel any pain outside the normal strain of mild discomfort from stretching or from using your muscles after performing repetitions of a weighted exercise. High intensity exercises are contraindicated. So during testing or training, any pain outside of normal, the testing session or training session should be stopped until the pain has been relieved and you feel like you can continue on. Some examples of some flexibility exercises would be, or to warm up and cool down, would be some slow dynamic stretches, range of motion exercises, or some slow to light cycling or walking. The pain scale can just be simple 0 to 10, 0 being no pain at all, and 10 being extremely painful during exercise, so you can gauge it. If you get up to 2, maybe you can continue on, but if it gets past 5 and you feel it starting to creep up more, you may want to terminate the exercise at that time. The most painless forms of exercise for each patient should be used for testing and training. This is true, but sometimes it's hard to get your cardiorespiratory fitness levels tested while you're swimming. May not be the safest, so, or doing pool activity. So, maybe a leg or arm cyclohygrometer hooked up to 12 lead or 6 lead EKG, CG would be a great way of testing and monitoring your vital signs and cardiorespiratory fitness level. 6-minute walk test could be one, etc. But when training, I feel like with arthritis, swimming is a great way, or pool exercises like water aerobics, any of that, just walking in water. Those exercises are performed and can be performed at a greater level because there is no direct impact of joints as much as it is when you're out of the water. Also, water temperatures are usually higher, should be higher and comfortable to you. ACSM recommends 83 to 88 degrees, which makes you feel comfortable, warm, and with that warm and comfort, your bones and joints seem to flow better through movement, pain-free. The exercise world has a thing called the FIT principles of exercise: frequency, intensity, time, type, and I like to throw in the E for enjoyment. Frequency for the aerobic exercises should be 3 to 5 days a week, as long as it's pain-free. And resistance, they say, should be 2 to 3 days a week. And your flexibility and range of motion exercises should be completed daily if possible. Sometimes, if the doctor suggests it or says it's okay, you can do flexibility training more than one time a day. As far as intensity, for deconditioned patients, 30 or 40% of your oxygen consumption reserve or heart rate reserve is a good start. For someone that is in pretty good condition and can move pretty good, 40 to 60% is a good recommendation to start. As for resistance exercise, a light moderate weight for 10 to 15 reps at a low percentage of your 1 rep max should be completed. You're not going to do a 1 rep max, or a patient with arthritis is probably not going to do a 1 rep max test. They might can do an 8 rep max test, and then you can do calculations and figure out the 1 rep max and then go from there to figure out how many times you can, how much weight you can do for 10 to 15 times and get you a good range to start. As for the time, for aerobic exercise, 150 minutes per week. So if you think about it, that's your 5 days times 30 minutes a day. Now, if the patient can't go 30 minutes without pain free or just not in shape, it's perfectly all right to do 3 10-minute sessions, 6 5-minute sessions if you have to start. But then you're going to progress up to trying to get that 30 minutes or even greater per day. Alrighty. Principles of exercise continue. The type. Low impact exercises like cycling, walking, and swimming are great for this population of people suffering from this disease. High impact exercises like running, stair climbing, plyometrics are most of the time stayed away from this population. You don't want to cause any unjust pain to these joints. They can progress into this, but mostly it's going to be contraindicated. For resistance exercises, everything's going to be individually based. So testing is key. And testing your physical abilities is going to be key here. And doing your 100% best during those tests is going to be key. And also knowing your pain threshold. So use of the Borg scale, which is a popular against fitness experts, or just that general 0 to 10 pain scale anyone can make up. And you want to use a weight that you can do at that body part for 10 to 15 times for maybe 3 to 4 sets per exercise. Lastly, the enjoyment. You always want to enjoy what you're going to do, because you're not going to wake up in the morning and be excited about going and doing stuff if you don't like doing it. I'm not anyway. Progression. This is based on the individual as well and how their body is reacting to the exercise. And main thing is it should be gradual and should be based off of pain and being symptom free. I went over most of these unique considerations for exercise during the slides, but we'll just go over and hit a bunch of these all at one time. Just like I said, this is like a review. Do not exercise during times of pain or inflammation, except you may be able to do some gentle stretches or range of movement exercises during this time if it's pain, to maybe help alleviate that pain. Perform at least 5 to 10 minutes of warm-ups and cool-downs before and after exercise. The 150 minutes exercise per week is recommended, but if your physical limitations doesn't allow you, you can build up to that doing 10-minute sessions, 5-minute sessions, whatever you can do till you can build up and progress up to that. Make sure you test your exercise sessions for pain. And that is, if you're still hurting in that particular joint 2-3 hours after the exercise session, you may need to change something and go back. So you're already testing your training system. This is a time of day you need to exercise. Exercise when the pain is least prominent. And you can do it in conjunction with taking your pain medication. But there's a thin line here as well. Don't go over, just because you feel good at that time, you're on pain medication. So don't go over your allotted reps and sets and time because you feel good. It could be the pain medication giving you a false sense of pain-free time during your exercise. Just to wrap it up, here are a couple other unique considerations before we finish. Always wear appropriate dress for your training. Your doctor can prescribe orthotics or special shoes for diabetics. For example, diabetics or for arthritic patients. Or he may know someone that knows your condition, a specialist that he can send you to. Also, you can wear compression socks or shorts or shirts that may add support or comfort, give you maybe keep you warm. It may help movement exercises to stay pain free. Always, always, always don't just stay to the machine exercises or treadmills or bicycles. You want to do functional training. And when I say functional training, things you do everyday activities like stooping down to tie your tennis shoe, getting up from a chair. So you want to maybe do some chair sits. Just stand in front of a chair. First thing to move would be your glutes, and just sit back until you hit the chair and resist your weight and gravity till you hit the chair. Maybe reaching up into a cabinet, filling a gallon milk jug of water, carrying it around. So you are used to that, about 8 pounds of weight all the time. Something to think about. And most importantly, to wrap it up, bottom line, exercise should be used to manage pain, short term and long term. And with moderate aerobic activities, with low joint stress, and adequate warm-ups and cool down and stretching are the most important things for pain-free. Once again, I can't stress being pain-free at this time. Always. Thank you. Lastly, I want to thank you for your time and patience on listening and viewing my presentation on exercise and arthritis. And after this is a couple of helpful websites and articles that has some more information about arthritis and exercise. My name is David Whitesides, student and Masters of Exercise Science at Lenore Ryan University.